Anal cancer, while less common than other forms of cancer, is emerging as a significant public health concern due to its increasing incidence, particularly among older women. It is a distinct form of cancer that originates in the tissues of the anus and is closely linked to the human papillomavirus, HPV, a virus responsible for about 90% of all anal cancer cases. Though the disease can be serious and life-altering, there is also hope in the growing awareness, improved medical screening, and highly effective preventive strategies such as HPV vaccination. However, as cases rise, especially in populations that were previously not considered high risk, the need for vigilance, education, and proactive healthcare becomes even more critical. Recent data from the United States and the United Kingdom highlight a worrisome trend. Between 2017 and 2021, the incidence of anal cancer increased significantly, most notably among white and Hispanic women over 65. In this group, rates rose by over 4% in just 5 years. The troubling aspect of this rise is that many of these women had already aged out of the HPV vaccination program by the time it became widely recommended, leaving them vulnerable to infection decades earlier. As the virus often lies dormant, the consequences may not manifest until much later in life. Without robust screening or awareness, many women may be unaware of their risk until the disease has progressed. Despite this concerning trend, there is also a positive shift in the medical community's ability to identify and respond to anal cancer. Research is helping to clarify which groups may benefit most from targeted screening for HPV and anal cancer, which could lead to earlier detection and better outcomes. Vaccination remains a powerful tool in preventing the disease altogether, particularly when administered before exposure to the virus. For younger generations, and for those who can still receive the vaccine, this represents a clear path forward in dramatically reducing future cases. Nonetheless, early detection is key, and it is here that both opportunity and danger lie. One of the major challenges in diagnosing anal cancer is that its symptoms often resemble far more common and less serious conditions. Bleeding, itching, or discomfort around the anus is frequently mistaken for hemorrhoids. Similarly, the appearance of small lumps may be dismissed as skin tags or benign growths. Even discharge, soft stools, or bowel incontinence can be attributed to minor gastrointestinal issues. These misinterpretations can delay crucial medical intervention, allowing the disease to spread beyond its initial site and reducing the chances of successful treatment. While this can be frightening, it also presents a clear call to action. The public, particularly older adults and healthcare providers, must be educated to recognize these warning signs not as mere annoyances, but as possible indicators of something more serious. When identified early, anal cancer is often treatable, and outcomes can be significantly improved. Encouragingly, there are also increasingly refined medical tools and diagnostic techniques that make detection easier and more precise than in previous decades. Routine checkups that include discussions about anal health, particularly in patients with a history of HPV, should be normalized rather than avoided out of discomfort or stigma. On a hopeful note, the heightened attention to anal cancer in both research and media is driving greater public awareness and advocacy for change. The same mechanisms that once contributed to the silence around the disease are now being dismantled. With more people understanding the role of HPV, the importance of vaccination, and the need for regular health screenings, we are moving toward a society better equipped to face this health challenge head-on. While the upward trend in diagnoses is a cause for concern, it is also a sign that more people are being tested, identified, and ultimately treated. In the end, the key message is both a warning and a reason for optimism. Anal cancer is real, and it is rising, especially in groups that have been historically overlooked. But it is also preventable, detectable, and, when caught early, treatable. The 6 signs: anal bleeding, itching, pain, unusual lumps, mucus discharge, incontinence, and increased urgency or softness in stools, should never be dismissed or self-diagnosed without professional input. They are red flags that deserve immediate attention. By listening to our bodies, seeking timely care, and advocating for preventive measures like the HPV vaccine, we can confront this rising threat with knowledge, compassion, and decisive action. Have you had a conversation with your doctor about HPV risks or screening options lately?